Over the past 15 years, the field of veterinary rehabilitation has experienced rapid growth. As rehab programs become a standard of care in veterinary medicine, therapists are innovating and finding new ways to get animals back to their normal lifestyles faster. At North Country Veterinary Referral Center, a practical approach is taken to rehabilitation that includes comprehensive diagnostics, rehabilitation exercises, hydrotherapy, and laser therapy.
Surgery is only part of the solution. Rehab allows those pets to get back to doing what they should be doing. If it's a standard of care for people, it should be a standard of care for our pets. Our discussions about rehab start at the same time as our surgical consults. When a pet comes in with a cruciate injury, our surgeon's already talking to them about rehab, when it will start, once surgery is complete. Rehab really requires owner participation either here in the rehab center and especially at home with homework in order for those patients to succeed. Here in the rehab setting, Rebecca and I will work as a team on both diagnostics and doing our initial consults, measurements, analysis, assessment, and coming up with a therapeutic plan for each individual pet. Rebecca then works with individual patients going through companion laser therapy, heat, massage, range of motion, and working with them on the underwater treadmill. We use the companion stance analyzer with every initial evaluation and also for all of our follow-ups. We always review with clients what normal should be. Normally, a dog's going to bear 60% of their weight in their forelimbs and 40% in their hind limbs, and balance that equally from left to right. The stance analyzer takes a lot of the guesswork or subjectiveness out of understanding how much weight they're actually placing. Patients are great at hiding factors on us, and we make assumptions. The stance analyzer takes all of those out of the equation. The stance analyzer allowed us to get objective data for our arthritic patients, for our neurological patients, to give a return to the owner on their investment into us on rehabilitation. They could see numbers that showed that their pet was getting better and putting better weight versus just taking my word for it. The companion underwater treadmill gives us a lot of versatility for our patients. By being able to control the rate of speed that they're moving, the depth of the water and how buoyant or not buoyant they are. We use our underwater treadmill for a variety of conditions. We'll use it for weight loss. We use it for arthritic conditions. We use it in helping neurological patients get back to function. Usually we will see results in as little as 2 weeks if we're seeing them twice a week. Clients enjoy the underwater treadmill. They see the benefit for their pets. They come in and they always say, oh, Fluffy's gonna go swimming. They're gonna go have fun. Zach's case is a great example of a success story using underwater treadmill therapy. He came in completely paralyzed in his back legs, and we have used the companion underwater treadmill as part of his protocol to get him back walking. Mom has been ecstatic to see him move since he could not do it initially on land, and now he's getting stronger both in the treadmill and also in the real world. Companion's laser is a great cog as part of the rehabilitative wheel to progress. We see it as being useful for so many conditions to help in patients' goals, getting them more comfortable, getting muscle spasms to reduce, helping wounds to heal, that allow us to work with those patients in their overall goals to get them back walking appropriately. With the versatility of the companion laser, from treatment areas from big dogs to little dogs, cats, and even exotics, while we treat a wide variety of conditions and patients, I feel a lot of confidence in the consistency that we get because of the protocols. If Rebecca's not here one day, I can go back and follow her exact protocol that she used on a patient. We know that we're getting the right amount of energy, the right treatment protocols to help the various conditions that we're seeing. We've had great response from owners on seeing improvement with laser as pets literally walk out the door feeling more comfortable. Norman came in after having back surgery for a herniated disc in his lumbar spine, was not able to fully use his hind limbs. Because of that, he had shifted a large amount of his weight to his front limbs. The stance analyzer gave us exact data on how much weight he was putting on his front limbs inappropriately, and now with a combination of laser therapy and underwater treadmill therapy, we're seeing him shift his weight back as his hind leg gets stronger and take the brunt off of his front limbs. This was reaffirmed with the stance analyzer. We use the stance analyzer, the laser, and the treadmill as part of a team approach to rehabilitation. The stance analyzer gives us a lot of good background info and helps us to know where to target the laser along with our physical exam. The stance analyzer then helps us to understand that the laser therapy has been effective, as well as we see that with the underwater treadmill and the laser, once we get muscles feeling better or joints feeling better, our pets are able to go longer and with more vigor in the underwater treadmill to help build muscle and achieve our goals.